Pimple popping is a phenomenon that has taken the beauty world by storm. From blackheads and milia to cystic acne and whiteheads, pimple popping has become a popular practice for addressing skin blemishes. In this blog post, we will explore the ugly, the bad, and the good of pimple popping. We will look at the risks of popping pimples, the proper techniques to do so, and the potential benefits that can come from this practice. So, if you're ready to learn more about pimple popping, let's dive in. What are blackheads? Blackheads, also known as open comedones, are a type of acne that can be caused by the accumulation of oil, dead skin cells, and bacteria in your pores. They appear as small black or dark spots on the skin and can be found most commonly on the face, nose, and back. Blackheads form when the pores become clogged with sebum, oil produced by the skin, and dirt. This then causes the top layer of the pore to oxidize and turn black. Blackheads are not necessarily caused by poor hygiene, but by factors like genetics, hormones, and diet. To help prevent blackheads from forming, it is important to keep the skin clean and free of excess oil. Additionally, regularly exfoliating your skin can help to keep your pores clear and reduce the risk of blackhead formation. What is cystic acne? Cystic acne is one of the most severe forms of acne. It is characterized by large, painful bumps that can form deep within the skin. These bumps are typically filled with pus and may be red and inflamed. Unlike blackheads or whiteheads, cystic acne does not have a visible head and usually occurs on the face, chest, back, or other areas of the body. It often affects people with oily skin. Cystic acne is caused when the hair follicles become clogged with bacteria, oil, and dead skin cells. It can also be caused by an overproduction of sebum, which is the natural oil produced by the body. Hormonal changes, such as those that occur during puberty, can also trigger cystic acne. This type of acne is usually more difficult to treat than other forms of acne, as it requires more aggressive treatments. If left untreated, cystic acne can cause permanent scarring. It's important to see a dermatologist if you think you might have cystic acne in order to receive the best treatment. Treatment options may include topical treatments, oral antibiotics, hormone therapy, and even laser therapy. It's important to follow your dermatologist's instructions in order to achieve the best results. What is the best way to remove pimples? When it comes to removing pimples, the best way to go about it is to start with a gentle cleanser and exfoliator. This will help to remove any excess dirt, oil, or bacteria from your skin. Additionally, using topical treatments such as benzoyl peroxide or salicylic acid can help to reduce the appearance of pimples and prevent new ones from forming. For blackheads, you can use a comedone extractor tool or tweezers to gently remove them. You should never squeeze a blackhead or whitehead, as this could cause scarring or damage to your skin. If you are dealing with cystic acne, you may need to speak to a dermatologist for more intensive treatment options such as antibiotics or prescription-strength creams. When it comes to pimple popping, it is best to proceed with caution. Popping pimples can cause irritation and even spread bacteria, which can lead to more pimples. If you do choose to pop your pimples, make sure to cleanse the area before and after popping and use an antibacterial ointment afterward. Overall, the best way to remove pimples is to start with a gentle skincare routine and use topical treatments. If you need to remove blackheads, do so carefully with an extractor tool or tweezers. Lastly, proceed with caution when it comes to pimple popping, and make sure to follow proper hygiene and safety measures. What are the side effects of pimple popping? Pimple popping can have some undesirable side effects, depending on the severity of the pimple and how it is popped. If done incorrectly, it can lead to scarring and inflammation. Even if done correctly, some people still experience redness and soreness afterward. Additionally, bacteria can easily be spread when popping a pimple, which can lead to further breakouts. If the skin around the pimple is not cleaned properly, it can cause the pimple to become infected. It is important to note that picking at a pimple can lead to acne scars. This occurs when the skin around a pimple is broken and the fibers that hold the skin together are damaged, leading to scarring. In order to avoid this, it is important to use the correct technique when popping a pimple, such as using a tissue or cotton swab to prevent bacteria from spreading. It is also important to be careful not to pop cystic acne. This type of acne is particularly deep and is usually characterized by large bumps beneath the skin's surface. It can be painful and difficult to treat, so it's best to leave these types of pimples alone and seek professional help instead. Overall, popping pimples should be avoided if possible, as it can lead to further inflammation and infection. However, if you must pop them, always do so with caution and use the proper technique in order to reduce the risk of side effects.